to welcome everybody to this afternoon to the sixth in our series of webinars about making Medicaid work for you. It is a new era. There are lots of new opportunities, and today we're going to share a little bit of review of what we've walked through over the last few weeks, but also talk about a few new opportunities to help you kind of think about what next steps might look like. So thanks again for being with us. My name is Tanya Dorf-Bruner. I'm the Executive Director here at Oral Health Kansas, and I'm really happy that you've joined us. As you can see, as I said, we are in the sixth of our series. We have one more next week that we'll talk about here in a little while. But let's start with just some logistics. And again, if you've been here with us every week, you know these logistics now. Please do use the Q&A box to ask questions. You're welcome to put any questions in the Q&A box just anytime, and we'll be answering as many of those as we can before the end. As always, we'll be capturing the questions and putting together a frequently asked questions document that we will be getting out next week. If you've got any technical problems, just email us or chat us. And as always, we are offering a total of 3.5 dental CEs for participating in the full series. So I know I've already seen several people do it, but if you need the CEs, put your name and email in the chat. And again, if you've been with us every week, you're familiar with this, but just want to tell everybody again, the Pathways to Oral Health program, which is this webinar series is a part of, is all about three main things: trying to provide support for dental professionals to be successful in becoming Medicaid providers, trying to provide education programs for both dental professionals and people with disabilities. And then next week, we will be talking about the communication tool known as My Dental Care Passport. So really happy again that you're here to help us as we work through these three main goals. The Pathways to Oral Health program is a really large collaborative with a number of different organizations working together to make this possible in working on all of those goals. You can see, of course, the Oral Health Kansas, the Kansas Dental Association, Community Care Network of Kansas, all of the Medicaid MCOs, and several other organizations are a part of this work. And we're always growing this circle. I'm really happy to have so many partners in it. This webinar series specifically is brought to you by both the Kansas Dental Association and Oral Health Kansas. It's funded by the Division of Healthcare Finance at KDHE through an ARPA grant. I'm happy to say Kevin Robertson from the Dental Association is with us this afternoon, and would also, maybe Kevin, if you want to say anything. Welcome, everybody.
Oh, no, thank you for being with us today. We're Kansas Dental Association is certainly pleased and happy to be part of this series. And we hope that you all become Medicaid providers by the time we're done or increase the number of Medicaid patients you see. So thanks for being with us.
Thanks, Kevin. That's the perfect segue to get into our content today. So we've got, you can see the agenda. And actually, at this point, I think I'm going to go ahead and pass it over to my colleague, Brian Thompson, who is our dental Medicaid facilitator. And Brian's going to get us started. Take it away.
Okay, thanks, Tanya. Just to go over the agenda, we're going to cover where we've been, the business case for Medicaid, making a difference in the community, the future outlook for where we go from here, and taking the next step. So you now know the mechanics. This session, we hope, will connect the dots to show how Medicaid participation can be both good business and good for Kansas families. So, in this webinar series, we've covered so many topics. Let's briefly review the information we've covered so far. Starting in 2022, the Kansas legislature invested in establishing a Medicaid adult dental benefit. That benefit grew in 2023 and 24, and this year the legislature invested in a significant increase in reimbursement rates. These changes didn't happen overnight. They came after decades of steady advocacy with lawmakers to improve the Medicaid dental program. The important thing is that the momentum is now moving in the right direction. CanCare is the name of the Kansas Medicaid program, and it's operated by 3 managed care organizations, or MCOs. In week 3, and then again last week, you had the chance to hear directly from each of them. Now, you should have their contact information for things like credentialing and billing. The links on this slide will take you straight to each provider's portal, and all the other contact details are in the slides from earlier webinars. There are a few steps in the process of enrolling and credentialing to be a Medicaid provider. The application takes about an hour, and the whole process of getting enrolled takes about 1 to 2 weeks. Credentialing may take another 60 days or so. You can get started at the link on this slide. Guidance about the process is available in the Enrollment and Credentialing webinar recording and on the Pathways to Oral Health website. Becoming a Medicaid provider does not mean you have to take all Medicaid patients. It's easy to see how that could be intimidating. You can set limits based on criteria like geography, age, number, or percentage of your patients. We'll talk more about how you can balance your payer mix in a few minutes. The key thing to remember is to treat Medicaid patients like any other patients. You can't put restrictions on them that you wouldn't put on anyone else. We've looked at the logistics. Now let's explore how accepting Medicaid can be a smart move for your practice. This year's rate increase and the addition of adult dental coverage create a real opportunity to serve more patients while keeping your practice strong. Adding Medicaid patients can be a smart way to balance your payer mix. One dentist told us that she looked at the new rates and was pleasantly surprised. They looked very promising. The key is to see how these rates fit with your goals and staffing so you can expand access while maintaining financial stability. Here you see just a sampling of the new rates. The rate increase went into effect in July, and some of the procedures increased by 30 to 50%. We know there's still room for improvement, and we're actively advocating for additional increases. The good news is that Kansas lawmakers have been very supportive, and we're making steady progress. In addition to higher rates, there are other financial incentives. The KIND program is a partnership between the Kansas Dental Association and Delta Dental of Kansas. KIND offers loan repayment for both dental students and existing dental providers to fill the critical need for Medicaid providers in rural Kansas. And by the way, only the 6 largest counties in the state don't qualify as rural. At a time when student debt is a major concern, these benefits can help you become financially secure while playing a vital role in your community and state. With the right approach, dentists really can do it all. Expand access, build a strong reputation in the community, and still keep the practice financially sustainable. The key is operational efficiency. Think about the tools you already have. Your practice management software can be a huge asset. Use it to track reports and streamline your day-to-day operations. And don't forget the basics. Automated reminders through email, text, or phone calls are one of the simplest ways to cut down on no-shows. It's also worth taking some time to get comfortable with the Medicaid Provider Manual. Knowing exactly when pre-authorization or x-rays are required can save you a lot of headaches and prevent claim denials. And here's a tip straight from the MCOs. Make the provider web portals your go-to resource. You can check eligibility in real time, submit pre-auths, and file claims all in one place. Finally, if you're not already doing so, consider signing up for electronic fund transfer. It's an efficient way to get paid quickly, and it's free. Financial health in a practice depends on a balanced mix of patients. Different payers reimburse at different rates. Actively managing your payer mix can help you maintain financial stability while also promoting access for all patients. The right payer balance is unique to every office. This is just one example of what it might look like. One way to understand your payer mix is by running insurance reports from your practice management software. That gives you a clear picture of who your patients are by payer type. From there, you can set targets for the mix you want. It's really about finding the right balance, making sure your mission to serve patients includes Medicaid, but doing it in a way that makes sense for your practice. And then take time to regularly re-evaluate your payer mix. If you see it drifting from your goals, adjust as needed. Dr. Aaron Booman, a Kansas City pediatric dentist, shares his insight about the untapped Medicaid patient pool in this video. We're not going to watch it today, but the link is right there for you. He also discusses some of the myths and facts about being a Medicaid dental provider, touching on many of the issues we've discussed throughout this webinar series, such as administrative burdens, Medicaid audits, the timeliness of Medicaid payments, Medicaid rates, managing your patient mix, and no-show rates. And we do have a few resources here to help your office identify your payer mix. Don't worry, we'll be sending out the slides later so you can get all those links. Of course, the business side is important, but many dentists tell us there's another layer that matters just as much. They go into dentistry because they care about people. With so many Kansans still struggling to get dental care and entire counties without even one Medicaid provider, dentists who step up really stand out. By accepting Medicaid, you're not just filling a gap, you're building your connection to the community you serve. In 2024, 419 Kansas dentists submitted Medicaid claims. About 50 of those were working in 36 community care clinics across the state. Those clinics are doing their part, but they can't carry the full load on their own. When private practice dentists join in, access improves, care is more evenly distributed, and the whole system works better for everyone. This map shows where Medicaid dental offices are located across the state. 41 out of the 105 counties in Kansas have no Medicaid dental provider. That means entire communities have no local access to Medicaid dental care. The result is that Kansans have to travel long distances or in many cases go without care altogether. So all the red you see on that map, the red zeros, are counties without a single Medicaid dental provider. Even accepting just a few Medicaid patients can have a big impact. You help families avoid costly trips to crowded emergency rooms, and you give children the chance to start life with healthy teeth. For adults with disabilities, who often wait the longest or go without care altogether, you provide a reliable dental home. Every patient you see makes a real difference, and your participation in Medicaid makes it possible. Community partners notice and value your participation. Schools, Head Start programs, and health departments are eager to collaborate with dentists who care for patients with Medicaid, because dental care remains one of the biggest unmet needs for the people they serve. We often hear from programs and agencies seeking dental services for people experiencing pain or infections. These partnerships help strengthen your referral networks, enhance your reputation, and reinforce your role as a trusted provider in your community. Dentists truly change lives for their neighbors. Dr. Nick Rogers is a general practice dentist in Kansas City. He's a longtime Medicaid provider. And in this video, he talks about the needs in his community and his leadership in addressing them. Again, the link to that video is there at the bottom, and you can go to it later. I encourage you to watch the full video about Dr. Rogers' work and impact on his community. We've talked about your community's oral health needs and the benefits relating to accepting Medicaid. But beyond participating, dentists also have an important role in shaping how the system continues to develop. As we've discussed, in 2025, the legislature added $10 million to the Medicaid program to increase the dental rates. While this was a great step, the rates are not yet at the level of commercial insurance. In 2026, a partnership of advocates will be returning to the state capitol to push for further increases to the rates. This is a tried and tested method. In Missouri, a significant increase in rates resulted in a dramatic improvement in the provider network, including reducing the number of counties without a Medicaid provider by half. We're committed to making sure the Medicaid system works for everyone. The addition of an adult dental benefit was a significant positive change. We understand that raising the rates on the fee schedule has not boosted the encounter rate for community care clinics. The steps taken to increase the number of private practices in the Medicaid dental network, though, are aimed at improving coverage for all Medicaid members across the state and helping relieve the strain on our vital safety net clinics, and are just one step in our collective years-long journey to a comprehensive and sustainable Medicaid dental system. The point is, to support Kansans' oral health, we need to support the state's dental providers. So some of the ways you can make a difference are to advocate with the legislature, share your experiences and ideas to influence policies that support both patients and providers. Being part of the Medicaid system puts dentists in a position to influence policy. Last year, dental providers and their teams were a critical partner of the advocacy efforts. In 2026, your voices will be more important than ever to help the legislature understand why a further increase to the Medicaid dental rates is vital to improve and maintain the dental provider network. This can range from talking with your colleagues, emailing your legislators, providing written testimony, and joining us at the Capitol to deliver your story in person, whatever works for you. Another way to help is to join OHK's Dental Provider Advisory Group. Work with peers and Oral Health Kansas to guide improvements, resources, and initiatives for Medicaid dental care. For example, this group influenced how the last rate increase was distributed across D codes. The group meets quarterly via Zoom, and it is a chance to talk with providers from across the state, to share, listen, and learn, and to help us learn how best to help you. This is a collective effort. The safety net system and some private offices have been doing incredible work to support Kansans on Medicaid. But alone, they are not sufficient to care for all Kansans insured by Medicaid. The numbers just simply don't add up. Remember, becoming a Medicaid provider doesn't require an overhaul of your practice. Adding even a small proportion of patients insured by Medicaid to your patient mix can help make sure the network is adequate to provide the care people need and reduce the strain on a too small Medicaid network, which is currently trying to carry the piano on their own. If you're already a Medicaid provider, thank you, and please talk to your peers. Now let's talk about what comes next and what steps you can take. The Medicaid system has changed a lot in the last several years. Nearly comprehensive coverage is now available for adults, even including dentures. The rates have increased, and now there are more resources available to help navigate becoming a successful Medicaid provider. As you dive into Medicaid, remember, You get to set the rules for your office. Your office can remain profitable as you provide care for your neighbors who need it most. Throughout this webinar series, we've shared links to many resources available to help you better understand the Medicaid system, how to enroll as a provider, who the payers are, how to file claims, and how to make Medicaid fit within your business. During next week's final session, we'll share a handy guide to all these resources, along with the frequently asked questions we've compiled throughout the webinar series. Kansas could really benefit from more dental offices welcoming neighbors with Medicaid. Opening your doors does not only support people who need care, it can also help your practice grow. A little kindness and a personal connection, especially with new Medicaid patients, can turn that first visit into a lasting relationship. This is a new era for Medicaid in Kansas, and there are more opportunities than ever to make it work for both your patients and your practice. So take the next step. Explore the Medicaid provider application, review resources from Oral Health Kansas, and connect with peers who are already making a difference. Every new provider helps build a stronger, healthier Kansas. And at this point, we're ready to try and answer your questions.
Thanks, Brian. That was really, really good. Thank you. As Brian said, yeah, we're happy to answer any questions people have. We did get one question early, and that was a really important logistical question, and that was whether we had shared the slides from last week. And they are all on our website, on the Pathways to Oral Health website under the webinar tab. We'll be sure and get that link out to you for though. And then today's webinar and slides will be out by tomorrow. But any other questions anybody has, we'd be happy to take a few minutes and answer any questions before we have to wrap up today. I don't see any questions. While everybody's thinking about that, let me do a couple of other announcements. As if you've been with us, you're also familiar now with the Accessible Oral Health Echo program we've been running with the KU Medical Center. This is it's a 5-part webinar series, started at the beginning of September, and we have, I think, 3 weeks left in this week and then 2 more. It's all about helping dental teams build more confidence to be able to provide dental care for people with disabilities. There's a national expert team with people from all over the country serving as experts and trying to provide insight in a number of issues. So if you're not registered for that, we would encourage you to register. It's free. There's CEs available, and those recordings will be available as well. And then just reminding everybody too, our own conference is coming up on Friday, November 7th. This is going to be a hybrid event, but the in-person event, which is where we would love to see you, will be at the KU Edwards campus in Overland Park. You can scan there to learn more, and I think Abby put a link in the chat so you can find out more information about that event and all the different topics we'll be covering. I don't see any other questions today, so we might give you just a few minutes back in your calendar, unless any of my colleagues have anything else they want to add before we wrap it up. I don't see anybody. Go ahead, Brian.
I'd just like to thank everyone who's participated in these webinars for your time and attention. And if there's ever anything you need, my role is to try and help you the best I can. So please don't hesitate to reach out.
Great. Thank you. Thank you so much. And again, thank you everybody for joining, and we look forward to having you back next week for the last in this series. And then hopefully we get to see you in November in Overland Park. Thanks, everybody. Have a good rest of your day.